Hello everyone, today we are going to discuss about Norma frontalis, which is a front view. Now let me enumerate the bones contributing in formation of Norma frontalis. So right from above downward, this is the frontal bone. Then these two are the nasal bones. Over here these bones are maxilla. On other side of maxilla, these two which are forming cheek prominence. These two bones are zygomatic bone. And below you can see this is mandible. So these many bones are contributing in formation of Norma frontalis. Let me show you individually all the bones. So this is frontal bone, and this portion of the frontal bone over here you can see this is forming skeleton of forehead. So this is frontal bone. Now over here you can see these two are nasal bones, and you can clearly see the suture over here. So this is the outline of nasal bone. Behind to that, this is the outline of maxilla, and lateral to maxilla, this is the zygomatic bone. The maxilla will form upper jaw. You can see the sockets for the teeth, and nasal bone and maxilla together will form the pyriform aperture of the nose. You can see over here. So if you connect frontal bone with this, say this. Now the overview of Norma frontalis is assumed. All what you need to do is you have to connect mandible below, so the entire Norma frontalis is formed. Now let's see the bony features of Norma frontalis. Now first in the frontal bone over here, as I mentioned, it forms skeleton of the forehead. Now over here you can see these two are bony orbits or sockets for the eyeball, and above to that over here you can see two clear cut bony ridges. These are called as superciliary arch or supraorbital ridges. Now deep to that lies the frontal air sinus. Now an imaginary point or imaginary meeting point of this superciliary arches, this portion is called as glabella. This portion. Now below to the glabella, where the frontal bone articulates with the nasal bones, in the midline, this point is called as nasion, where the frontal bone and nasal bones they meet. So that is a meeting point of frontonasal suture, and over here there lies internasal suture where both the nasal bones are fused. So a meeting point of frontonasal suture with internasal suture, this is termed as nasion. Now above to the superciliary arch, over here you can see on other side of the midline, particularly in children and females, two bony elevations are observed. These are termed as frontal tuber. Okay, so in case of male skull they are not much prominent, but in case of children and in female skull they are very much prominent. Now let's see orbital openings. Now two orbital openings are found on either side of the midline, and these are pyramidal in shape. So the apex will be inside, and over here on front what you see is the base, and it has got four walls: roof, floor, medial wall and lateral wall. So the base is over here, the apex is deep inside. Now for the detailed description of the bony orbit, please visit my separate video. Now so far as Norma frontalis is concerned, the base of the bony orbit is observed over here, and it has got four margins, namely supraorbital margin, infraorbital margin, the medial margin and lateral margin. Now in the supraorbital margin, obviously you can see that it is contributed throughout by the frontal bone, and at the junction of medial 1/3 and lateral 2/3 over here you can see there is a foramen, or it can be a notch. It is termed as supraorbital foramen. If it is a notch, then it is termed as supraorbital notch, and supraorbital nerve and vessels will pass through it. Just medial to it, supratrochlear nerve and vessels will pass through. Now regarding inferior orbital margin, medially it is contributed by this maxilla, and lateral it is contributed by this zygomatic bone. You can clearly see. Now lateral orbital margin, the major portion is contributed by the zygomatic bone. You can see over here. Whereas the upper portion, the lateral orbital margin is completed by the frontal bone. So there are two processes basically. This is zygomatic bone, it is giving frontal process, and this is frontal bone, it is giving zygomatic process. So from below the frontal process of zygomatic bone and from above the zygomatic process of frontal bone, they will complete lateral orbital margin. Similarly, the medial orbital margin, it is completed by, this is the frontal process of maxilla and it has got a lacrimal crest. You can see a sharp crest. So that is contributed by the lacrimal crest of frontal process of maxilla, and from above it is completed by the frontal bone. So two bones are contributing, frontal bone and the lacrimal crest of frontal process of maxilla. They will complete medial orbital margin. Now let's see pyriform aperture of the nose. It is pyriform in shape, it is narrower above, broad below, and it is completed by two bones. From above, these two are nasal bones, and the lower free margin over here of the nasal bone will form the upper boundary of pyriform aperture, whereas below it is completed by nasal notch of the maxilla. This is maxilla and this is its nasal notch. Let me show you in separate bone. Now say this, these two are maxilla attached in the midline and they are having attachment of nasal bones also. So they are also attached in the midline with internasal suture and the lower margin is free. So that forms upper portion of the pyriform aperture, and if you see a maxilla separately, you can see this is the nasal notch. That forms lower margin. So if we join these together, these two bones will form the pyriform aperture of the nose, and in living the aperture is providing attachment to cartilage and the soft tissue. So the complete external nose is formed. Now here you can see this is nasal bone, and in midline it is connected by its counterpart to form internasal suture. Similarly, the maxilla, in the midline it is attached with its counterpart to form the intermaxillary suture, and at the meeting point over here you can see clearly there forms a bony elevation. It is termed as anterior nasal spine. Let me show you an articulated skull. So here you can see anterior nasal spine. Now when you see lower end of internasal suture over here, this point is termed as rhinion. Now in the lower part of the face, over here you can see the major contribution is from the maxilla and zygomatic bone. So in the maxilla, over here as we have discussed, this is nasal notch, and behind to that is the frontal process. Okay, you can see over here clearly this process will run upward and medially, and that will fuse with the frontal bone with frontomaxillary suture. Posteriorly it is attached with the lacrimal bone, and anteriorly it is attached with the nasal bone. So this is the frontal process of maxilla. Now over here it forms part of the medial margin and lower margin of the orbit, and below to that, approximately below the midpoint of inferior orbital margin, approximately 1 centimeter below, you can see a foramen. This is termed as infraorbital foramen, and infraorbital nerve and vessels will come out of it. They are basically coming from the pterygopalatine fossa through this infraorbital notch, which is converted into infraorbital canal in the roof of maxillary air sinus. Again, for detailed description, please visit my separate video of pterygopalatine fossa. So this is anterior surface of the maxilla. Below it forms alveolar process, you can see over here, and that is having sockets for the teeth. If you see the alveolar process in this portion, this is canine tooth. So above to that there is an elevation, this is called as canine eminence, and medial to that there is a depression which is situated above the incisor. So this is termed as incisive fossa. Similarly, lateral to the canine eminence there is a depression. This is termed as canine fossa. It has got another process. This is zygomatic process, which is attached to the zygomatic bone, and it has a palatine process which articulates with its counterpart and with the palatine bone to form the hard palate. So what we are concerned with Norma frontalis is the frontal process of maxilla, the nasal notch, the alveolar process, and the zygomatic process. So that is about maxilla. Now let's see the zygomatic bone. Again, it has got three surfaces: the anterior surface, the orbital surface, and the posterior surface. Out of the three surfaces, the anterior surface, it forms prominence of the cheek, and into that generally there is a foramen observed, that is termed as zygomatico-facial foramen, which allows passage of zygomatico-facial nerve, which is a branch of zygomatic nerve. Let me show you in separate bone. So this is zygomatic bone, and this is its anterior surface. This is orbital surface, which forms part of the boundary of bony orbit, and this is posterior surface, which is formed part of the boundary of temporal fossa. Now this is anterior surface, and as I mentioned, it forms prominence of the cheek, and over here there will be a foramen. This is termed as zygomatico-facial foramen. The same name now will pass through it. Now below to that is the mandible. As you know, it forms lower jaw, and it's the only bone which is mobile in skull. So this is mandible. It has got a stout body, and that forms a ramus. Ramus has got two processes: coronoid process and condylar process, with a head with a constricted neck, and the lower portion is the base, which is rounded. Meeting point of the lower border or the base in the midline, this point is called as gnathion. It has got an alveolar process which forms alveolar arch. It has got sockets for the teeth, you can see over here. And again, for detailed description, please watch my separate video for mandible. Now again, in the body, midway between upper border and lower border, over here you can see approximately midway between two premolars, there runs a foramen. Over here you can see, and this is termed as mental foramen. The mental nerve and vessels will come out of it. Now let's see the foramina in Norma frontalis, namely the supraorbital foramen, infraorbital foramen, mental foramen, and over here over the external surface of the nose there will be a small foramen, and again on the zygomatic bone there will be zygomatico-facial foramen. So there are total 5 foramina on either side of the midline observed in Norma frontalis. Out of the 5, the supraorbital foramen, infraorbital foramen, and mental foramen, they are running almost in a straight line. And there is another peculiarity regarding these 3 foramina, is that the structures passing from these foramina, like supraorbital foramen, it allows passage of supraorbital nerve. It's a branch of ophthalmic division of trigeminal nerve. The infraorbital foramen will allow passage of the infraorbital nerve, which is a branch of, or which is a continuation of maxillary division of trigeminal nerve. And from the mental foramen there comes out mental nerve, which is again a branch of mandibular division of the trigeminal nerve. So these 3 foramina, the supraorbital, which is in the frontal bone, infraorbital, which is in the maxilla, and mental, which is in the mandible, the 3 foramina, they are in the line. They are found in 3 different bones, and they are allowing passage of all 3 divisions of the trigeminal nerve. The small foramen over the external surface of the nasal bone will allow passage of a vein, and that will drain blood from the nasal mucous membrane. And in front of the zygomatic bone or its anterior surface, the zygomatico-facial foramen, which allows passage of zygomatico-facial nerve, which is a branch of zygomatic nerve. So this is regarding foramina observed in Norma frontalis. Hope you understood well. Thanks for watching.